Welcome to Vikas Learning, where we're making learning new and different.
Session 4, U.S. Healthcare Insurance Terms.
Patient. A patient is an individual who is receiving medical care or treatment. Inpatient. This term refers to a patient who is admitted to a hospital for treatment that requires at least one overnight stay. Inpatient care can be due to serious injuries, illnesses, or conditions that require extended monitoring, treatment, or surgery. The admission to the hospital can be either planned or unplanned. Outpatient. This term refers to a patient who receives medical treatment that does not necessitate an overnight stay in a hospital. Outpatient care can involve short-term hospitalization, routine doctor visits, or procedures that allow the patient to return home the same day. The classification of a patient as an inpatient or outpatient is significant as it can influence how insurance companies process claims and reimbursements. Understanding these terms is crucial because they can substantially affect the coverage and costs related to healthcare services. Guarantor. A guarantor is an individual or entity that agrees to take on the financial obligations of the policyholder if they are unable to fulfill them. In essence, a guarantor serves as a safety net or cosigner, providing assurance to the insurer that they will receive payment if the policyholder fails to meet their obligations. The guarantor is typically the person responsible for the patient's bill. If the patient is a minor or an incapacitated adult, the guarantor could be a different individual. It's important to note that the guarantor does not necessarily have to be the insurance customer, spouse, or head of the household. Subscriber. A subscriber is the individual who holds the insurance policy. They are typically the insured party and the recipient of the policy benefits. In most cases, they are also the individual responsible for paying the insurance premiums. However, the person paying the premium could be either the subscriber or the guarantor, leading to these terms sometimes being used interchangeably. It's crucial to understand that the roles of a guarantor and a subscriber can differ based on the specific terms of the insurance policy and the circumstances of the insured individual. For accurate information, always refer to the specific policy documents or consult with an insurance professional. Dependent is an individual who can be included in an insured person's health insurance plan. Dependents are typically family members or legal dependents who rely on the primary policyholder for financial support and healthcare coverage. A dependent in health insurance is a person who is among those who are covered under your insurance plan. Any family member whom you want to provide insurance coverage to in your health insurance plan can be included as a dependent. This typically includes the insured spouse, children, legally adopted children, and parents. In some cases, insurers may also allow in-laws to be included in the dependent list, subject to certain conditions. When it comes to insurance coverage, a dependent is a person who is eligible to receive benefits under an individual or group insurance policy. Dependents can include spouses, children, and in some cases, other family members or individuals with certain qualifying relationships. Dependents are typically covered for medical expenses, dental care, prescription medications, and other healthcare needs. The specific definition and requirements for dependents can vary depending on the type of insurance policy, such as health insurance, life insurance, or disability insurance. It is important for policyholders to review their insurance policies and understand the specific terms and conditions regarding dependent coverage. A healthcare provider is indeed a person or organization that provides medical services. This broad term encompasses professionals like doctors, nurse practitioners, and midwives, as well as facilities like hospitals and urgent care clinics. It also includes entities like labs that conduct medical testing and companies that supply medical equipment. These providers all work together to ensure individuals receive the care they need. A payer, also known as a payer, is indeed an individual, organization, or entity that pays for the healthcare services provided by healthcare professionals. This term is most commonly used to refer to health insurance companies. These companies offer health plans to their customers that cover the costs of and provide reimbursements for medical treatments and care services.
Thank you for watching.